The purpose of this video is to demonstrate the excision of a dorsal carpal ganglion cyst. Ganglion cysts are frequently mistaken for tumors. They are highly benign and in general do not need to be removed unless they are painful at the extremes of both flexion and extension, although in my practice many patients insist after the cysts have been there for a long time for me to remove them. The skin is incised through a small incision on the dorsum or the extensor side of the wrist down through the fat, and great care must be taken not to injure any sensory nerves. The incision is brought down in between the tendons that extend the thumb and extend the finger, down to the joint capsule where the ganglion cyst herniates out from. It is usually full of mucus. In this case, the cyst itself is empty and devoid of mucus. Frequently, there's a small nerve that needs to be excised called the posterior interosseous nerve so as to prevent postoperative pain, and one can actually see removal of that small nerve branch. It does not cause any loss of function in the hand. That nerve goes to the wrist. There frequently has to be an opening in the joint capsule to remove the cyst because it has a mucin, M-U-C-I-N, mucin duct, D-U-C-T, at the base, and that is usually cauterized, and the joint capsule is then closed tightly when possible with absorbable suture, usually chromic catgut. With the suture cut down to the knot, the skin is then closed with non-absorbable Prolene suture. Sutures stay in for 10 days, and patient must keep the arm elevated for 48 hours, dressing clean and dry, and the patient must take it easy on that wrist for 4 weeks so as to avoid recurrence. This procedure is successful about 85% of the time.